Hi everyone, Dr. Timothy Gallagher here again from Maragal Medical. This week we're going to be talking to you about conservative treatment options for hip pain. Over the last several weeks, a lot of patients have been coming into the clinic complaining of pain in or around the hip. And this week our medical director, Dr. Michael Marciello, is going to be talking to you about all the different causes of hip pain, as well as all of the treatment options that we have here at our physical medicine clinic. You're not going to want to miss this one. Stay tuned. You know what, Dr. Mike? We've been seeing a lot of patients come into the clinic complaining of hip pain. And this is definitely an area that isn't as simple as it would originally present itself. Sometimes, patients point to the hip. Sometimes patients point to their back, like the sacroiliac joint. What are some of the common presentations that you've been seeing over the last couple of weeks with patients with hip pain or pain in that region?
Yeah, without question. Commonly, whenever I hear someone coming in with hip pain, I always think there's probably something else going on.
Right.
Because the hip, when we classically think to our side, is more referred pain.
Yeah.
The hip joint actually comes into the groin more, so we actually may have a hip arthritic problem or hip pain. Really, we think about a person complaining of groin pain.
Right.
But when a person complains of hip pain, like they point again to their SI joint, it could be in fact a pelvis problem.
Sure.
Could be a back problem referred down. Could be a form of sciatica that hasn't really reached all the way down yet and is referring out to the side of the hip, which really is the buttocks and the muscles of the hip.
Yep.
But many commonly, we actually would have bursitis, we'll have tendonitis, but we really will see a combination of things when people really point to the side.
Yeah.
So we have to think of hip second in that category. Think of pelvis, lower back first.
Okay. And then at our clinic, since we're pretty unique and we offer, both medical care, chiropractic treatment, and physical therapy, what are some of the common treatment options that patients have?
Well, without question, we want to start with some basic x-rays. We want to start with some good old condition. Look at the spine, look at the pelvis, look at the hip joints themselves. And then we start thinking about, okay, we got to mobilize that.
Yeah.
We get some chiropractic. We can get some deep laser to some of those tissues on the side. You're getting inflamed at the tendon, the bursa, really coming down the side. Laser really works well for that.
Absolutely.
We look at aspects of trying to strengthen. We use our Hanova, we use our physical therapy. Colleen gets in there and we got to strengthen those muscles to the side of the hip, and that supports our core. So we really want to do some basic diagnostic stuff, making sure the structure is looked at. And then we really look at figuring out ways we can add benefit. Then we get into some more deeper things like an injection, trigger point injection just in the muscle.
Right.
Or we could actually inject into the joints, being at the spine, the SI joint, and even the hip itself. It really was a hip problem to look at our regenerative injections and our PRP and our Wharton jelly type of things. These are great choices as we come to the diagnosis of where the origin is from.
Absolutely. I think from a chiropractic perspective, oftentimes it can be a little bit scary for a patient to actually think about getting their hip adjusted. So we're going to kind of cut off to Dr. Dave and I spend a little time just demonstrating on what a gentle chiropractic adjustment looks like. So, we'll pan over to that.
Hello, Dr. Dave Sherman.
And like we said, we're going to demonstrate what a chiropractic adjustment looks like with the hip. And I think oftentimes when patients are told that they're going to be adjusted, sometimes some fear comes across them of what is that all about? I think this would be a good opportunity to show what the adjustment looks like. It's very gentle. And the whole key with this, the chiropractor's role, is really to get those joints moving. So when we're talking about patients with hip pain, particularly due to arthritis, we got to get that joint moving.
Yeah, and so easy. Very simple, low force, comfortable, and I think if you see it, you realize how easy it is.
Perfect. So I'm gonna have myself go down on my stomach. Right?
Okay, perfect. Sounds good. Yeah, and just to give an idea, so we come in very gentle from here, and I'm just gonna lightly traction on the hip here to help open it up.
That feels really good, actually.
Nice stretch, right?
Yeah.
Just opens up the joint itself.
And I actually feel a little bit of relief into the lower back too.
Well, that's the thing. At this point, if we get more motion on the hip, then actually help the back as well too. So we'll actually bring both into this.
That's great.
Really good feel, right?
Perfect.
As you can see, real gentle. Still very effective though.
Yeah.
Yep.
And that just goes to show that team approach. Chiropractor's role is to make sure we're keeping that joint moving.
Yeah, it's key. And like we were saying before, the hip bone is connected to the...
It all goes up. That's great, guys. And as you can see, a real gentle procedure. The chiropractor's role in the practice is to make sure that we're getting those joints moving. And like you said, all the other treatment options like the physical therapy, the injection therapy to help, either loosen the muscles or repair some of the damage in the joint really is an advantage for the patient in that we're looking at it at all angles. If you know anybody that's suffering with hip joint pain or pain into the hip or around into the pelvic area, have them give us a call. We'd be happy to evaluate the patient. We're also doing and continuing our work with our fall prevention program. As Dr. Marciello talked about, our fancy robotics technology, the Hanova, and we're seeing some great response with that. If you'd like more information about our practice, just click on the link below, maragalmedical.com, and we'll talk with you soon.